So at the end of the post-op medication regimen, where it says post-operative instructions for breast and body, we talk about the medications. So most of the time, I'm going to send your prescriptions to a pharmacy that will be able to mail your prescriptions to you. Why I do this is because I write for a variety of medications, and very few pharmacies have everything that I need. And I don't want you going all over town trying to get your medications. You're going to get your medications before surgery so that after surgery, if you're in pain, you're not like looking for stuff, okay? I'm really big on our rapid recovery protocol. At the surgery center, they give you IV Tylenol, which helps reduce pain and inflammation before it starts, and I do inject you with a bunch of numbing medicine. Now, the other medications that you get are designed to help you have a good experience after surgery, okay? Surgery does hurt, you may be sore, but my regimen keeps it from being unbearable. All right, and I expect most of my patients to be off of their pain medications. If it's just breast, 2 to 5 days. If they've had a mommy makeover, I've had people off their pain medication as early as 3 days. Some people as long as 10 days, okay? It just depends. It doesn't mean you're a wimp if you need pain medication longer, okay? Now, insurance usually doesn't cover a lot of the medications that I write for because they're good meds, and they don't like paying for stuff that, is good. So the pharmacy will call you. They'll take your insurance. If your insurance covers any of it, great. If not, they'll give you a fair cash price. If they don't, let me know and I'll deal with them, okay? So almost all my patients get a medication called scopolamine. It's like a little circular Band-Aid that you put behind your ear on the skull bone over here, okay? That's the only medication you're gonna take before surgery. So the night before surgery, when you go to bed, you're gonna stick it on your skull bone. It may make your mouth dry. It might make you dizzy if you stand up too quickly. If you touch the patch and touch your eye, you will get blurry vision for like a week, okay? So you'll put that on before you go to bed the night before surgery. So if your surgery's on Friday, take it Thursday night, like when you're going to bed. You just put it on there. Leave it on the day of surgery. The morning after surgery, so if your surgery's on Friday, I'm saying Saturday morning, you're gonna take it off and throw it away, okay? Then wash your hands. All right, this helps reduce nausea from anesthesia. You're gonna get a bunch of pills. A lot of them might be due at the same time. You can take all your medications together if they're due at the same time. But make sure you have a little bit of food or at least some food in your stomach. Drink lots of water. And when I say drink lots of water and fluids, what I mean is like you should be drinking about half a gallon at least of fluids. Not coffee, but like water, Gatorade, juice, okay? Like you should be flooding yourself with fluids because you're gonna have a lot of inflammation and you need the fluid to flush out the toxins and to help you have good blood flow so you can heal. So make sure you have food in your stomach, and when you take your pills, make sure you're sitting upright for 30 minutes afterwards so you don't lay on your back and just start puking up all your pills, okay? So most of my patients will get a muscle relaxer. It's called cyclobenzaprine. It helps reduce the muscle spasm. That happens like when you tighten the muscles of the stomach or when you stretch the muscle of the breast, when you put an implant underneath the muscle. So you're gonna take that 3 times a day for 5 days, okay? You're gonna get an antibiotic. Most people will get Keflex. If you have an allergy, let me know, but you're gonna take it 3 times a day for 5 to 10 days, okay? Whatever's written on the bottle, follow those instructions. Your pain pills. You're either gonna get Norco, which is hydrocodone and Tylenol, or you're gonna get Percocet, which is oxycodone and Tylenol. That's important because you don't want to take Tylenol on top of those pain pills because then you're going to kill your liver and then you might need a liver transplant. So don't do that. You're going to take 1 or 2 pain pills every 4 to 6 hours. Don't try to be a hero. So if you take 1 pill and you're like, or let's say you feel good right after surgery, take 1 pill because there's numbing medicine in there and inflammation peaks over 2 days. So take 1 pill. If you're like, oh my God, it hurts. Take a pill, wait 15 minutes. If it still hurts, take a second one. I don't want you to be miserable. It's okay if you're in pain to take 2 pain pills every 4 hours. The way it works is a lot of times, like let's say your antibiotic is 3 times a day, then you're gonna take your muscle relaxer, your antibiotic, and a pain pill or 2. Then 4 hours later, you're gonna take a pain pill or 2. Then 4 hours later, you'll take your antibiotic, pain pill or 2, and then muscle relaxer, okay? It's just the way it is. When you take narcotics, you don't poop as often. So you're gonna drink lots of water like we talked about, and you're gonna take Colace, which is a stool softener, twice a day starting in the morning of surgery, okay? I don't want you to be constipated. Now, it's normal to not have a bowel movement for 3 or 4 days after having surgery. If you have not had a bowel movement after 3 days, please have someone go to the store and buy milk of magnesia and take 30 milliliters 3 times a day till you poop, on top of all the other stuff I give you. Okay? If you do happen to get diarrhea, I need to know about it because some people can get a weird infection from taking the antibiotics, and it can kind of clean out their colon where the bad bacteria take over. So if you have diarrhea, that's not a light matter. Please let me know. Okay? So that's that. And I don't like puke, so I write you for a very expensive nausea medicine. It's important to take this. The cancer patients take this before chemotherapy. So imagine if you're one of the people that gets nauseous after surgery because of anesthesia, you're going to be puking. Someone's got to get a hold of me. I might be in surgery. You got to wait till I'm done. Then I got to write you a prescription. Someone's got to go to the store. It's not worth it. This stuff is called Zofran or Ondansetron. It's a little pill, and you put it, doesn't look like this, but just using it as an example. You're going to put it on your tongue. You're going to let it melt. And then 15 minutes later, you can eat a double from In-N-Out and some fries and a milkshake. Okay? It's awesome. All right. Then, if you're getting breast implants, I'm going to have you take vitamin E. That's vitamin E. The pharmacy will send it to you, 400 units twice a day for 1 year after surgery. Now remember, that can thin your blood a little bit, so if you're getting like another medical procedure or something, you might want to stay off it for a week. Also, I like to get people off the narcotics. I will most likely write you also for ibuprofen, 800 milligrams. But ibuprofen can make you bleed. Remember, it's on the list of things that you shouldn't take for a week before surgery. I don't want you taking the ibuprofen until I tell you you can. So keep the ibuprofen like hidden somewhere, but I just want you to have it so that when I'm ready to transition you, you're okay. All right? So I hope that this helps. And anyways, I'm really excited for your surgery. Let me know if you have any questions. It's a lot of material, but we're very thorough. My patients are prepared. If you watch the videos and read all the material, there's no way you can get this wrong. Thank you.